Good morning, Patrick here, coming live to you again from Complete Health Eastbourne. And I just wanted to really just touch on an interesting subject that people will ask me pretty much every week, which is what's the difference between a chiropractor, an osteopath, a physio, or all of these different practitioners? Now, the answer to this question is as loose as the question is to me, in the sense of when you ask what's the difference, the answer is going to depend on the practitioner. With regards to chiropractic, my understanding of chiropractic is it's a very holistic profession, looking at all of the factors that cause disease. Now, the original chiropractor, Dr. Daniel David Palmer, actually looked at 3 T's. He called them the 3 T's, which is thoughts, toxicity, and trauma. Thoughts, toxicity, and trauma. And essentially, these 3 T's added up and created this stress and dysfunction in the body. And as a result, that is what the cause of all diseases and injuries were. And as a result, that is what chiropractic is basically looking at, trying to correct. It's looking at those 3 T's. So it's a holistic therapy. Now, physiotherapy, I actually believe, ties in really well with chiropractic care, because chiropractic care will look at improving the function of someone's bodies, the function of someone's spine, the function of someone's muscles and nerves. And then physio really works to actually help rehabilitate and strengthen those dysfunctions that chiropractic has actually looked to correct. So as many of you will probably already know, in our clinic, we actually integrate our care. We have both chiropractors, physios, and massage therapists in our clinic. And often I will actually recommend more than one type of therapy. Pretty much with all plans that I do, I include massage. I include massage with all of my patients because I know how important it is to include the soft tissue work within our profession. Now, the other thing that we obviously have to understand is that if we try to do too many skills or juggle too many hats, we actually start to lose track of what it is that we're actually starting to do. So as chiropractors, my main focus is on improving the function of someone's nerve system, the way that the brain and the nerves actually interact. And the way that we do that is improving the way that the spine and the joints function so that the feedback information from those joints is improved to the brain. Now, physio will actually use exercise in order to strengthen these pathways once they're clear. So in my opinion, they are different. However, they complement each other exceptionally well. Now, interestingly, there is one other profession that people quite often ask me about, and that's osteopathy. Now, osteopathy is a very similar profession to ours as chiropractors. They use the word manipulation. I tend to use the word adjustment. But they still actually move joints in the same way that chiropractors do. They tend not to do as much, and they try to mix their therapies a lot more. So their emphasis isn't always looking at the function of the way that the nerves work. And so as a result, sometimes it's a little bit more of an overall and using all of the tools in the toolbox. Now, my experience, the biggest difference between chiropractic and osteopathy care is chiropractic generally looks at the longer term, and rather than just getting people out of pain, they look at the preventative and maintenance measures as well. And chiropractors are actually legally allowed to take and interpret X-rays in this country, which osteopaths cannot do. So there is a diagnostic advantage going to a chiropractor versus an osteopath or physio, because there is one skill that chiropractors have that other healthcare professionals in this country do not have. So just to summarize, chiropractic's really looking at the way that the nerves work and the way that our lifestyle actually starts to inhibit or disturb these functions. E.g., looking at the 3 T's, thoughts, toxicity, and trauma, and how that actually starts to affect the way that nerves interact with our system and how it starts to affect our organs, our muscles, our nerves, and our joints. Osteopathy was much more looking at lesions and correction in circulation, but the original chiropractor actually posed the question to the osteopath and said, well, what controls the circulatory system, and it was always the nerve system. So BJ Palmer and DD Palmer were always very quick with osteopaths to say, well, actually, if you think about your circulation, what is it that actually controlled circulation? It was the brain and the nerve system. And physio, brilliant for rehabilitating those muscles, strengthening joints back up again. However, if there's a dysfunction underlying that hasn't been corrected, or the tissues are still injured, you may find that actually with physio, you have to go through that process of correcting things first and then start looking at the strengthening and rehabilitating later on. Guys, I hope you've really found this helpful. If you want to learn a little bit more about how our physios, our chiropractors, our massage therapists work here at Complete Health, please just leave us a message or drop a comment in the text below. We're here to support all of our clients, especially during this tough time. Keep an eye out. We have got a lot of offers and specials going on this month. We're trying to support other local businesses. We're also actually supporting our clients in the local area, just trying to get you guys back into the economy and actually working as normal again. So we hope to see you in the clinic again soon. Oh, by the way, just a last little notice is that our physios are coming back to work from next week, and we also have a new chiropractor starting with us as the clinic starts to grow. So we are really looking forward to boosting that up. So keep an eye out, because we've got some new patient special offers coming through, and we've got some live events in the clinic that are going to start coming up very, very soon. See you all soon. Take care. Patrick Hogg from Complete Health Eastbourne.